Patients line crowded hospital corridors waiting for days for operations. Forced to use filthy facilities because there's no money for cleaning materials or even toilet paper. Hospital staff resorted to collecting money among themselves in order to buy food for patients. Just some of the problems that have prompted Health Workers Union Nehawu to call into question the competence of MEC Benny Malakoane. But the Health Department denies there's a crisis.
The crisis is a breaking point. What we have is financial constraint. We've got severe financial constraints. These financial constraints are uncovered as a result of the diligent work that has been happening throughout the period of the year since the MEC was appointed.
These constraints were allegedly inherited from the previous administration, and the department says it's investigating shady dealings dating back to before 2008. But what about the lack of food and basic supplies such as gloves and needles? Responsibility for that's been shifted to facility managers.
It is wrong for people to put the blame squarely on the department when it is management ineptitude that leads to the supply of desperately needed equipment in the facilities.
They also admit that a shortage of functioning equipment such as orthopedic drills and anesthetic machines led to a backlog of operations at Pelenomi Hospital, but say this has since been resolved. And plans are in place to get all its facilities running smoothly. Not everyone is convinced that MEC Malakoane has the chops for the job, though.
We're going to have the system that is collapsing unless if somebody comes from somewhere and rescue the situation.
They cite ongoing drug shortages across the province as evidence.
The major issue that we're looking at is shortage of ARVs, which basically they decided to fix last week after we made a lot of noise about it. Your high blood medication is not there. Your TB medication for kids, it's not there. So those are the challenges that we are faced with.
The department has rejected claims millions is being spent on upgrades to the MEC's offices while clinic pharmacies run out of stock. They say only modest upgrades were done in order to make the offices an appealing space for visitors. But they do admit their financial woes have made it hard to always pay suppliers on time. A radical turnaround has been promised, and they say the plans they have in place will ensure smooth sailing ahead. But those in the know say chances of this happening without national intervention are slim. Bloemfontein.
You deserve to know more.
enca.com